Mr. President, I had the honor of listening to you when we had the meeting here in Ghana about sovereignty in health. And when I heard you speak, I said, is that a professor of public health? If you have not been made one, I would like to suggest that you are made one as soon as possible. On behalf of the Association of Medical Councils of Africa, it's my great honor and privilege to welcome you to the 20th Annual Scientific Conference. Why are we chosen Ghana as our meeting place? We meet on Ghanaian soil with gratitude and with deep sense of purpose because Ghana holds a distinguished place in Africa's history. A nation whose independence have awakened the hope of freedom across the continent. We do cherish the founding father of this nation for what he has been able to do, what he was able to do for Africa. It's therefore fitting that we gather here to consider another form of freedom. That is freedom of every African person to seek and get healthcare with confidence. Ghana also offers a compelling setting for this conversation because of its continued commitment to health reform and African self-reliance. What are the examples? Initiatives such as the uncapping of the National Health Insurance Fund. Many countries in Africa are still struggling with the health insurance fund. The free primary health care policy, the Ghana Medical Trust Fund, and the convening of the African Health Sovereignty Conference, which was held here in Accra, which reflects an important determination to expand access, improve quality, and respond to the health needs of our people. On behalf of AMCOA, I would like to express our sincere appreciation to the government and people of the Republic of Ghana for the warm welcome extended to us. I experienced it firsthand when I was picked from the airport, and then the welcome cocktail party that we had with that all-African female band. We are especially grateful to the Presidency and the Minister of Health and the Medical and Dental Council of Ghana for hosting this important gathering, and for its dedication, professionalism, and generosity with which conference has been organized. To our sponsors, and we have many of them, partners, and we have several of them, speakers, well clearly chosen, and moderators, not forgetting the volunteers and the AMCOA Secretariat, which continues to do a commendable job. Thank you for your contribution that has brought us together. Now, this year's theme is responsive regulation for safer communication towards universal health coverage. When we talk about universal health coverage, plenty of things come through our minds. But I'll demonstrate that regulators are quite central to universal health coverage. This meeting is timely and urgent. It reminds us that regulation is not just an administrative exercise conducted at a distance from people's lives. Regulation is a public promise. It's a contract that we regulators have with the people that we take care of. Remember, we talk about caring for the public, protecting the public, and guiding the profession. So that sets us in a very central position in the healthcare delivery system. It's the means by which society can trust that the person who is examining the patients is properly qualified, that professionalism standards are clean and clear, that education and training are fit for purpose, that wrongdoing is addressed fairly, promptly, and that innovation improves care without compromising safety, ethics, and dignity. As chairs of the medical councils, one of the things that we do is to sign the register that releases the doctor to the public, to the world. And the question that I always ask myself is, as I sign this, am I sure that the doctor is competent? Am I sure that he is safe to be released to the public? And that is the role and responsibility of the regulatory councils as we take part in training and monitoring performance of the doctors. Across Africa, health systems are changing very rapidly. Our populations are growing and becoming more mobile. The burden of disease is evolving. Technology, our friend AI, is very busy. It's reshaping diagnosis, treatment, education, and professional practice. These changes bring great opportunity, but also it raises difficult questions about accountability, data protection, workforce mobility, ethical oversight, equity, and quality of care delivered across borders. No council can protect the public effectively while working in isolation. Our task, therefore, is to build regulatory systems that are not only strong but trusted, not only independent but accountable, not only technologically enabled but human-centered, and not only nationally effective but capable of working across borders. Universal health coverage cannot be achieved merely by expanding access to services. Access without quality can cause harm. Access without ethical practice can destroy trust. Access without competent, adequately supported, and fairly distributed workforce will leave too many communities behind. Regulation must therefore be recognized as a central pillar of universal health coverage. It connects education, professional entry, continuing competence, ethical conduct, patient safety, and public confidence into one continuous system of protection. Strong health regulation contributes directly to Sustainable Development Goal 3, including the target of universal coverage. It also supports Agenda 2063, the OAU agenda, the aspiration for a prosperous African founded on inclusive and sustainable development, and for an Africa whose progress is people-driven, especially by its women and young people, and which protects its children. Regulation may appear technical, but its ultimate purpose is profoundly human. During this conference, we have an opportunity to move from shared concern to shared action. As a Christian, we always remember the centrality of Christ in our lives, where it says Christ is the center. And in this case, we as regulators and service providers, we are looking at our clients, the patients, the people that we look after as central in what we do. During this conference, we have an opportunity to move from shared action to shared vision. I encourage us to focus on 5 practical commitments. Number 1, first, let us strengthen cooperation and information sharing among African regulators. Secondly, let us promote greater alignment of regulatory standards while respecting national laws and contexts. Third, let us modernize regulation responsibly. Digital systems will make registration, licensing, continuing professional development, and complaint processes more accessible and efficient. Fourthly, let us place the public and the patient more firmly at the center of regulation. Communities must know what standards they are entitled to expect, how to raise concerns, and how regulators will respond. Lastly, let us invest in the capability and resilience of our regulatory institutions. Effective councils require skilled people, sustainable resources, strong governance, clear laws, and the independence to carry out their mandate without fear or favor. Those commitments demand more than conference resolutions. They require follow-through when we return home. They require collaborations between councils, government, training institutions, professional associations, civil society, patients, and development partners. They also require us to measure progress honestly and to learn from one another. I hope, therefore, that our deliberations will produce practical outcomes that will include stronger policy recommendations, an AMCOA capacity building roadmap for regulatory science, country commitments to training, knowledge exchange, improved system for regulatory data sharing, and where appropriate, technical working groups and AMCOA. These are the kinds of outcomes that can carry the conference theme from this hall into institutions and communities across our continent. Colleagues, AMCOA exists because Africa's health regulators understood that our challenges are connected and that our solutions must be shared. Over the years, that is almost 20 years, the association has become a platform for peer learning, capacity building, ethical leadership, and continental cooperation. As we engage over the coming days, that is the next 3 days, I invite each delegate to bring not only expertise, but openness. Openness to new evidence, to the experience of other jurisdictions. Let us ask difficult questions respectfully. Let us share practical solutions generously. Let us build relationships that continue long after the closing ceremony. But most importantly, let us remember the who stands at the center of this work. Number one, it is the patient in a remote community waiting for competent care. It's the young health worker, professional, seeking clear guidance and fair opportunity. It's the family that needs confidence that a complaint will be handled with integrity and swiftly. It is every member of the public who trusts our institutions to ensure that healthcare professionals are worthy of their trust. Therefore, may the deliberations of this 28th annual conference lead to a stronger institutions, closer continental cooperation, and practical reforms that improve the lives of our people. May we leave Ghana with a renewed resolve to make regulations more responsive, communities safer, and universal health coverage a reality for all Africans. Once again, welcome to AMCOA 2026. May our time together in Africa strengthen the partnerships and the practical actions needed to build the safer, healthier, and more equitable Africa we all seek. I thank you all.
Thank you very much, Asante Sana, Professor Okulo. Your Excellency, distinguished ladies and gentlemen, AMCOA is built on collaboration across borders. And this morning, Ghana has the honor of hosting colleagues and partners from many countries representing different regions of our continent and beyond. For the formal introduction of the countries represented at AMCOA 2026, it's my pleasure to invite Legal Counsel for the Association of Medical Councils of Africa, Advocate Michael Onyango. Advocate Onyango.
Your Excellency, the President of the Republic of Ghana, and riding on the protocols already established, and all delegates, good morning. No, we can do better. Good morning. Thank you very much. As has been said, my name is Advocate Michael Onyango from the Republic of Kenya. I serve the citizens of Kenya as the Corporation Secretary and Director Legal Services at the Medical Dental Council. I also serve the citizens of the great continent of Africa as the AMCOA Legal Counsel. My duty today is to quickly steward us through country introductions so that we may know who is here, who is in the room, the organizations represented, and the countries that they come from. Now, I just want us to imagine we are boarding an aircraft, an airplane under the company called AMCOA. Can we do that? We are boarding. I'm sure most of the international delegates came in by flight. I would be surprised if any of the local ones came in by flight, but for the international delegates, ladies and gentlemen, good morning and welcome aboard AMCOA Flight 28, operating this journey with the final destination in Accra, Ghana. For those who joined us at AMCOA's previous conference, held last year in Uganda, welcome back. For those of you joining us for the first time, we are delighted to have you on board. Before we depart, please fasten your seatbelts, place your phones on silent, and keep your notebooks and pens within easy reach. During the course of this flight, we shall be making several important stops across Africa. At each stop, we will introduce the country and welcome the colleagues who have joined us from that jurisdiction with a hearty round of applause. There may be some turbulence along the way, as there inevitably is in health professional regulation, but our crew is highly experienced and I am confident we will navigate the airs successfully. And before we commence our journey, allow me to introduce the cabin crew that will be assisting Captain Professor Joel Okulo, that is Manco. We have First Officer Professor Afolabi Lesi, the Vice President of AMCOA from the Medical and Dental Council of Nigeria. Kindly just please be upstanding. The cockpit is a bit crowded. We have a number of first officers. We have Dr. Afrika Gasana from the Republic of Rwanda and the Rwanda Medical and Dental Council, a MANCO member. We have Professor Arthur Rantwane from the Health Professionals Councils of South Africa. We have Dr. Divine Banyubala from the Medical and Dental Council of Ghana, a member of MANCO. We have Dr. Kami Chetty from the Health Professionals Councils of South Africa, and she heads the Secretariat. And we have Dr. David Kariuki, the CEO of the Kenya Medical Practitioners and Dentists Council, head of AMCOA committees. That is my boss. Just one more round of applause. Thank you, and myself, Michael Onyango, serving as the AMCOA Legal Counsel. And part of the flight passer for this AMCOA is Ms. Sadika Komei from Health Professionals Council of South Africa. But through love, she has found Ghana to be home. You can find her on the sides to understand that better. But Flight Passer Sadika is assisted by an able team of flight attendants, the AMCOA Secretariat. Wherever you may be in the room, just quickly be upstanding. These are ladies and gentlemen drawn from the various councils in Africa who have volunteered their energies and time to support this noble cause. So ladies and gentlemen, we are now about to start our journey across Africa. So sit back, relax, enjoy the journey across Africa. Cabin crew, arm slides and cross-check. AMCOA Flight 28 is about to depart. And we start our first stop in Burkina Faso. Please, Burkina Faso, be upstanding. Thank you at the back there. We are out west. AMCOA now flies down south to the Kingdom of Eswatini. Kingdom of Eswatini. Thank you very much. We fly east to the Republic of Kenya. Republic of Kenya. Thank you very much. We fly again down south to the Kingdom of Lesotho. Kingdom of Lesotho. Then now we fly out west to the Republic of Liberia. Thank you very much. We fly down south again to the Republic of Malawi. Republic of Malawi. Thank you. We fly east to the Indian Ocean to the Republic of Mauritius. Again, once again, down south to the Republic of Namibia. We come out west again to the Federal Republic of Nigeria. Out east again, thank you very much. Out east, we go again and we make a stopover at the Republic of Rwanda. Republic of Rwanda. Once again, we go into the waters of the Indian Ocean and fly east to the Republic of Seychelles. Seychelles. Thank you very much. Out west again, across the continent to the Republic of Sierra Leone. Thank you, right there at the back. Then we fly again to the Horn of Africa to the Federal Republic of Somalia. Then we fly down south to the Republic of South Africa. Then we go back up east to the United Republic of Tanzania. Out west again to the Republic of the Gambia. Then, I think this is a new entrant into our flight. This is the Togolese Republic. Thank you and welcome to AMCOA. Then we have where we were last year, the Republic of Uganda. And then we go to the Mosia Otunya, the Great Falls. We start with the Republic of Zambia. And across the border from Livingstone into Victoria Falls, we go last but not least in this particular case to the Republic of Zimbabwe. Thank you very much. Your Excellency, just a few notable guests, special guests that we have in the room today. We have Dr. Tebogo Hosi Leclerc,
Republic of South Africa, and an AMCOA honorary member.
From the United States of America, we have Ms. Nicole Swami, who is the chairperson of the International Association of Medical Regulatory Authorities, IAMRA. Joining her from IAMRA, we have Professor Martin Fletcher and Mr. John Shinfield, both working for IAMRA, directors, kindly be upstanding. For representing the Consortium of Medical Schools in Africa, we have Professor Titus Ibekwe. And representing the Educational Commission for Foreign Medical Graduates, InterHealth, we have Ms. Colleen McClintock and Ms. Cara Olin from the United States of America. Ladies and gentlemen, we have now begun our descent to the destination for the 28th AMCOA Annual Conference. Please fasten your seatbelts, return your seats to the upright position. I can still see some people slouching. And prepare for landing. But before we touch down, allow me to remind you where we're about to land. We are arriving in the Republic of Ghana, the Gold Coast, the gateway to West Africa, and the first sub-Saharan country to gain independence from colonial rule in 1957. We are landing in the land of Kwame Nkrumah, whose famous call for African unity still resonates across our continent and across AMCOA. We are landing in the country of its famous kente, vibrant culture, music, football, and at the risk of starting a diplomatic row, the best jollof rice. Republic of Ghana, you can clap it as well. Led by very special guest, the head of delegation, His Excellency the President of the Republic of Ghana. May we ask everyone who is from the Republic of Ghana to be upstanding, and we give them a hearty round of applause. Thank you very much. As we approach our destination, it's worth reminding ourselves why we have made this journey. This year's conference theme is responsive regulation for safer communities towards universal health coverage. What better way to think about responsive regulation than through the journey we have just taken? We have introduced different countries who have different regulatory systems, different historical aspects, different approaches, and different realities. Yet, despite these differences, our destination is the same. We regulate not simply because legislation requires us to do so. We regulate because ultimately our work contributes to safer communities and better health outcomes. As we work towards universal health coverage, our challenge is to ensure that our regulatory systems remain responsive to the needs of the communities that we serve. Ladies and gentlemen, we have arrived at our conference destination, but our work is just beginning. On behalf of the crew of Captain Professor Joy Okulo, assisted by his first officers, and the flight passers and attendants, the Medical and Dental Council of Ghana, AMCOA Flight 28 welcomes you all to this great republic. Please remain seated until the aircraft has come to a complete stop. Thank you all for flying Air AMCOA, and welcome to the 28th AMCOA Annual Conference. Thank you.
Thank you. Should that be Captain Advocate Michael Nyango? That was really, really innovative. Excellency, distinguished ladies and gentlemen, healthcare regulation ultimately exists in service of one overriding objective: the protection and well-being of the public. Government policy therefore remains central to the regulatory environment in which our institutions operate.
It's now my privilege to invite the Minister of Health of the Republic of Ghana to address the conference. Your Excellency, distinguished ladies and gentlemen, please welcome the Honorable Minister, Honorable Kwabena Minta Akandor, MP.
Thank you very much, my brother Kafui. Your Excellency, the President of the Republic of Ghana, President John Dramani Mahama, honorable members of Parliament, the Chairman and board members of the Medical and Dental Council of Ghana, the President and members of the Executive Committee of the Association of Medical Councils of Africa, President, chairpersons, registrars, and the Chief Executive of Medical and Dental and other health professional regulatory authorities, representatives of professional associations and training institutions, development partners, distinguished guests, ladies and gentlemen, on behalf of the government and people of Ghana, I warmly welcome you to Accra. To all those who have traveled from across Africa and beyond, I say Akwaba to you. You are among friends. You have come to Accra at an important time. This is the home of the Accra Reset, championed by His Excellency the President of the Republic of Ghana, President John Mahama, and helping to lead a conversation across Africa and the global south on resetting the global health architecture from fragmentation towards coherence and from dependency towards greater sovereignty. It is therefore fitting that regulators are meeting here. If we are asking whether the global health architecture remains fit for purpose, we must also ask whether our regulatory architecture remains fit for the societies we now serve. Ladies and gentlemen, permit me to acknowledge the Association of Medical Councils of Africa. For 28 years, the association has brought regulators together, advanced standards in medical education and professional practice, facilitated learning across jurisdictions, and above all, helped protect the African public. Africa says thank you. And to our own Medical and Dental Council of Ghana, thank you for bringing this important conference to Ghana. Your Excellency, our theme connects three ideas: responsive regulation, safer communities, and universal health coverage. Universal health coverage simply means that somebody can enter a health facility or that government has paid for the service. It must also mean that the person providing that service is properly trained, competent, appropriately licensed, practicing within defined standards, and has the tools required to deliver safe care. Every clinic we open, every service we make free, and every additional person to whom we extend healthcare is a promise to our country, men and women. Good regulation helps us deliver on that promise. After all, access without quality is incomplete, and coverage without competence can expose people to harm. That said, regulation itself must be responsive. Responsive in speed, because we cannot take months to verify a qualification when a district hospital urgently needs a doctor. Responsive in reach, because citizens should be able to easily establish whether the person treating them is properly licensed. Responsive in redress, because complaints must be investigated and resolved fairly. and responsive in scope, because we must regulate the healthcare people receive today, not the healthcare of 20 years ago. Ladies and gentlemen, the workforce is the backbone of the health systems. Africa's health workforce grew from 4.3 million in 2019 and to 5.72 million in 2024, with more than 325,000 graduates now produced annually. Yet, the continent still has only about 46% of the workforce it needs, whilst almost 943,000 trained health workers were unemployed in 2024. That tells us that our challenge is not simply one of numbers. It is one of planning, financing, training, deployment, retention, and regulation. This year, 2 major meetings in Accra reinforced that message. The second Africa Health Workforce Investment Forum called on us to plan, train, retain. Ghana's annual health summit complemented this with commitment on competency-based training, accreditation, continuing professional development, fitness to practice, and better workforce data. I believe this conference should add a fourth imperative: plan, train, retain, and regulate well. Ladies and gentlemen, President Mohamed's government also accepts its side of that compact. We cannot regulate for competence without investing in competence, and we cannot demand high standards without creating the conditions in which professionals can meet those standards. Government is therefore committed to decentralizing specialist training, expanding postgraduate opportunities closer to where services are needed, strengthening competency-based training, and ensuring that practitioners progressively have the infrastructure and equipment required to practice to the standards expected of them. Because a competent doctor without functioning diagnostics cannot consistently provide the standards of care against which we hold that doctor accountable. Professional accountability must therefore go hand in hand with system accountability. Bottom line, the practitioner must remain competent and ethical. The regulator must assure standards and protect the public, and the government must provide the enabling environment for good practice. This is why we continue to invest in equipment, specialist training, and advanced care capacity, including cardiac services. Distinguished delegates, we must also future-proof regulation. Telemedicine, artificial intelligence, cross-border practice, and new models of tax sharing are already changing healthcare. The questions are immediate. Who is accountable when artificial intelligence informs a clinical decision? How do we regulate a telemedicine consultation across borders? How do we define safe scopes of practice as tax sharing expands? These developments carry risk, but also enormous opportunities. Properly regulated telemedicine can extend specialist expertise to underserved communities. Clear scopes of practice can safely expand workforce capacity, and appropriate standards for artificial intelligence can allow Africa to harness these technologies on our own terms. Responsive regulation does not lower standards. It ensures that standards keep pace with reality. Good regulation does not simply close doors, it opens them safely. Your Excellency, let me return briefly to Accra Reset. Its proposal is relevant here. Africa and the global south must shape our own regulatory environment that requires deeper South-South learning and stronger cooperation among Africa regulators. The Association of Medical Councils of Africa can lead this by strengthening credential and license verification, regulatory intelligence sharing, appropriate mutual recognition, and common African approaches to emerging areas such as artificial intelligence, telemedicine, and cross-border practice. Indeed, why should a qualification rigorously verified by one trusted African regulator start from zero in another? And why should we separately solve regulatory problems that we already share? This is about building trust across borders and ensuring that African institutions help write the results that govern African health systems. Your Excellencies, ladies and gentlemen, the government of President John Dramani Mahama is expanding Ghana's continuum of care from free primary health care focused on prevention and essential services to the Ghana Medical Trust Fund, supporting specialized and high-cost care for chronic conditions. But these reforms ultimately depend upon a workforce that is competent, properly equipped, ethical, and accountable. So as you deliberate, I leave you with one question. Are our regulatory systems keeping pace with the societies we are called to protect? Let us learn from one another. Let us make verification faster and safer. Let us use regulatory data more intelligently, and let us build common African responses to challenges that no longer respect national borders. Above all, let us remember, our purpose is not to regulate more, it is to regulate better. That is responsive regulation. That is how we build safer communities, and that is how regulation contributes to the promise of universal health coverage. Once again, Akwaba, welcome to Accra. I wish you a fruitful and a successful 28th Annual International Conference. I thank you so very much for the opportunity.
Thank you very much, Honorable Minister for Health, Honorable Martin Akando, Akando, MP. Your Excellency, distinguished ladies and gentlemen, we now come to our keynote address. Our conference asks how responsive regulation can contribute to safer communities and ultimately to universal health coverage. Few people are better placed to provide a global perspective on that question than our keynote speaker, who is one of Ghana's and Africa's most distinguished global health leaders. Served for many years at the World Health Organization, rising to become Assistant Director General and subsequently Deputy Director General. Our keynote speaker has touched some of the defining global health initiatives of our era, from the revision of the international health regulations and programs addressing neglected tropical diseases to major international initiatives in vaccines, HIV/AIDS, tuberculosis, malaria, and maternal and child health. Our keynote speaker was also part of the United Nations team appointed by then Secretary General Kofi Annan to develop the Millennium Development Goals, and later chaired the interagency process responsible for developing the health component of the Sustainable Development Goals, SDGs. And before his international career, served Ghana as Chief Medical Officer and Director of Medical Services. Your Excellency, distinguished ladies and gentlemen, it is my privilege to invite our keynote speaker to address us. Let's welcome Dr. Anefi Asamoah Ban.
one of the advantages of having good friends is that you get a gracious introduction. Praise the Lord. Thank you, Kafui, my friend. Your Excellency, Mr. President, Head of State, Head of Government, Commander-in-Chief, Ghana Armed Forces, and now Professor of Public Health. I pray that GTEC doesn't write to you. Honorable Minister of Health, Members of Parliament, President and Management Committee of AMCOA, Chairman and members of the Board of Medical and Dental Council of Ghana, registrars, former registrars, chief executive officers of sister regulatory agencies, professional associations, development partners, and our international partners. Distinguished ladies and gentlemen, dear colleagues and friends, I'm grateful to the organizers for inviting me to this conference and for asking me to make a few remarks on the topic responsive regulation for safer communities towards universal health coverage. My work has been made easier by the excellent speech by the Health Minister, Prof. Okulo, our advocate, the Captain, and Prof. Akusa. But to justify my being here, please allow me to make 3 points and to leave you with 5 reflections. May the words of my mouth and the meditations of my heart be acceptable in your sight. My first point is about change. As you heard, the health landscape is changing and changing very fast. Disease burden is changing. The environment in which healthcare is delivered is also changing. Technology is changing and the expectation of our populations are changing. But perhaps the least talked about changes, however, is the rapid expansion in the number and diversity of players in the health sector. Now we no longer talk only about the traditional health workforce, doctors, nurses, pharmacists, but we talk about the health community today, which includes lawyers, engineers, economists, architects, technology experts, and many more. Healthcare has become a complex tapestry of professions, institutions, technologies, and interests. And in this tapestry, regulation is even more important than it has ever been. But regulators themselves must evolve. Indeed, sometimes they must not only react to changes, but they must anticipate changes and be proactive. The dinosaur is extinct. It's extinct not because it wasn't powerful. It's extinct because it failed to adapt sufficiently when the environment around it changed. The lesson for regulators is simple: adapt or risk being irrelevant. Responsive regulation is therefore not simply about responding quickly. It's about understanding how the environment is changing and ensuring that regulatory institutions remain relevant to that environment. My second point is about the need for regulators to be responsive to the expectations, aspirations, and perceptions of the public. Quite recently, a study was conducted to assess public perception of what medical counsel on our continent do. The findings were informative and instructive. There were some good news and some not so good news. Most people confuse medical councils with medical associations. I mean the professional associations. Among those who knew about medical councils, most recognize you as the institution responsible for registering doctors. And here I'm using the term doctors broadly to include dentists, physician assistants, and the other professional groups that different councils may regulate within your respective jurisdictions. The public also know you for inducting newly qualified professionals, dealing with fake practitioners, and sanctioning practitioners who fall below the required standards. Interestingly, the public seems to be particularly happy with your induction ceremonies. But there are also less favorable perceptions. There's a perception that when it comes to discipline and sanctions, medical councils tend to be soft on doctors. It's a perception. At the same time, there's a perception that when it comes to registration, you can be particularly hard on foreign trained practitioners. Very few members of the public appear to understand the considerable work that you do undertake in certain standards for medical education and professional practice, continuing professional development, and in maintaining standards throughout the practitioner's professional life. C'est dommage. I'm trying to impress you that I can speak some French. Whether all these perceptions are accurate is another matter, but perception matters. A regulator may know what he's doing, but if the public does not understand what you're doing, there's a trust gap. Responsive regulation must therefore include listening to the public, understanding how the regulator is perceived, explaining your decisions, and demonstrating that you exist ultimately for the public interest. My third point concerns universal health coverage. In the era of universal health coverage, regulators must not be seen as obstacles or part of the problem. Regulators must be part of the solution. One misconception about universal health coverage is that it's simply about doing more of what we already do and providing financial protection. That is partly true, especially the financial protection part. But universal health coverage represents a much more fundamental paradigm shift. Universal health coverage is three words: universal, health, and coverage. Universal speaks to the concept of universality. Everyone matters. Normally in the health sector we celebrate when we achieve our magical 80%. After all, in the university, when you get 80% is first class. And in politics, 80% is overwhelming majority. But in the era of universal health coverage, 80% is not good enough. Because 80% means 20% are not covered. 1 in 5 are not covered. And very often those left behind are not randomly distributed. They are the poor, people living in remote and difficult to reach communities, communities with bad roads, no roads, potholes. They are people with no identity documents, minorities, people living with disabilities, people affected by stigma, people caught in conflicts and environmental disasters. And here is the difficult part. the strategies that got us to 80% may not be the strategies that will take us to even 85%. Reaching those who remain excluded may be more difficult and more expensive. One size will not fit all. This has implications for regulation too. The second word is health. UAC challenges us to adopt a more holistic understanding of health. For far too long, we've been used to a very simplistic distinction. You are either sick or you are healthy. And naturally, our priority has been those who are sick. So we've developed a health system that is heavily oriented towards sickness care. But there's a third category. These are the people who are not sick, but who are also not truly healthy. In fact, many of us sitting in this room probably is in this third category. Health exists on a spectrum. UAC therefore requires health systems that promote health, prevent disease, identify risk early, treat illness appropriately, and support people to maintain well-being throughout their lives. The implications extend to the professionals we train, the competencies we require, and the standards against which practice is assessed. Let me talk briefly about the third word, coverage. It forces us to engage what is sometimes described as the economics of health. Healthcare is not cheap. And in health, to a significant extent, we reap what we sow. We cannot expect good health outcomes if we are not willing to invest adequately in health. For far too long, our part of the world has depended heavily on external support and impulse for critical aspects of our health development. Time has come to increase domestic financing of our health systems and strengthen our capacity to meet our own needs. Mr. President, we recognize and salute your leadership. But there's another side to this conversation. Our health systems face not only inadequate resources, but also wastage and inefficiency, a toxic cocktail. A substantial amount of healthcare expenditure is lost through unnecessary interventions, duplications, inefficient processes, and inappropriate use of resources. For example, it is estimated that 30% of all prescriptions and lab investigations are unnecessary. The UAC agenda is therefore not simply about putting in more money into health and removing financial barriers. It must also be about value for money, efficiency, ethical stewardship of resources, and accountability. And regulators have a role in that conversation. Having made my 3 points, permit me to briefly leave you with 5 reflections, just 5. Reflection number 1, tell your story. Medical councils have been around for a long time. As an association, this is your 28th annual conference. This is worth celebrating. You deserve an applause. Unfortunately, despite the important work you do, much of the public still knows very little about you. The conventional wisdom within our profession has often been somehow it is improper to promote ourselves or explain what we do. What we normally say we are good people. We've been ordained by God to do what we do. People should know what we do. If they don't, too bad. It is not our business to advertise ourselves. I believe that thinking must change. We need to find smart and ethical ways to tell our story. It's not about advertising ourselves. It's about public engagement. Explain what you do. Explain why you do it. Explain how your decisions protect patients. Publish appropriate information about your work and your impact. Listen to the public. If people encounter you only when they need registration or when something has gone wrong, they will inevitably have a very narrow understanding of your role. Responsive regulation requires visible, accessible, and trusted regulators. Reflection number 2. Sorry, I've abused your patience. My second reflection concerns the need to be inclusive and fair. Regulators are sometimes misunderstood. There are genuine concerns about variations in the quality of medical education across institutions and jurisdiction. Some foreign trained practitioners may require additional assessment or preparation before they are ready to practice within a particular system. Regulators cannot ignore these differences. But at the same time, there's a public perception that foreign trained practitioners may sometimes face unnecessarily difficult regulatory pathways. That's why I commend the Medical and Dental Council of Ghana for instituting a common national licensing examination, fair and equitable application, Similarly, there's a perception among some members of the public that medical councils instinctively take the side of doctors when disputes arise between practitioners and patients or their families. Those familiar with your work know that the reality is often far different. But if your disciplinary findings and regulatory outcomes are not communicated, of course, subject to legitimate requirements of confidentiality and due process, an information vacuum develops. An information vacuum are quickly filled by suspicion. Whether these perceptions are fair or unfair, they cannot be dismissed. Responsive regulators must ask why such perceptions exist and what can legitimately be done about them. Fairness must not only exist, fairness must also be seen, understood, and experienced. Reflection number 3. Move from blame to patient safety. Medical errors and avoidable harm remain a major challenge in healthcare. It is estimated that 1 in 10 patients are harmed when they visit our health facilities. 1 in 10. They go to our facilities and they are harmed. Patient harm is not simply the product of a few bad health workers. Often is systemic. But the practitioner matters, certainly. But so do staffing levels, communication, equipment, supervision, leadership, teamwork, organizational culture. Our approach must therefore go beyond simply identifying and punishing the bad ones. Of course, where there's reckless, willful, or seriously unprofessional conduct, accountability is necessary. I'm looking at Prof. Akusa. But we must also build a culture where errors and near misses can be reported, analyzed, and used for learning. There's much we can learn from the aviation sector, including its emphasis on reporting, learning, standardization, and continuous improvement. Medical councils can help champion this paradigm shift. The objective should not simply be to ask who made the mistake. We should also ask, why was this mistake possible? And how do we prevent it from happening again? This is how regulation contributes to safer communities. Reflection number 4, expand without compromising standards. And this relates to universal health coverage. To achieve universal health coverage in our continent, we need more professionals. That means expanding training capacity. We need more training institutions, more medical and dental schools, and more opportunities for people to enter the health professions. But expansion and quality must not be treated as competing objectives. We must expand training without compromising standards. And the role of the regulator should be to help make safe expansion possible. We need to demystify, democratize, and decentralize medical and dental education. Training should not remain unnecessarily concentrated in a few institutions or major cities when appropriate capacity can be developed elsewhere. Here again, I commend the Medical and Dental Council of Ghana. I am biased because I'm a Ghanaian. For champion decentralization of both undergraduate and postgraduate training in Ghana, leveraging technology and colleagues in the diaspora. But producing more doctors is only part of the solution. Having more doctors achieve little if they are not where they are needed. And our gains are diminished when large numbers migrate without mechanisms to replace, retain, or remain connected to their expertise. The labor market is complicated because shortages of health professionals are a global phenomenon. Every country in the world has shortage of health professionals. The rich ones have decided to poach rather than train. So we cannot wish migration away, but we can address some of the factors that drives it. Governments and employers must improve the working and living conditions of health in which professionals can practice and develop. And that leads me to my final reflection, my first final. And it concerns the future doctor we want. The doctor of tomorrow must be more rounded than the doctor of my becoming a she. Must of course be more knowledgeable and clinically competent, but that will not be enough. The future doctor must also be technologically savvy, a team player, emotionally intelligent, compassionate, a good communicator, a responsible steward of resources, and a good manager of people and systems. Yet our current approach to medical education, particularly at the pre-service level, remains very strong in biomedical science, clinical knowledge, while sometimes giving insufficient attention to communication, empathy, teamwork, respectful care, and conflict management. These are not soft skills. They are clinical skills. professional skills, and increasingly their patient safety skills. If these are the doctors we want, then these are the doctors our educational standards, curricula, and assessments must deliberately seek to produce. Medical councils have an important role in shaping the future through the standards they set for education, training, and professional practice. And once again, I commend medical councils that have adopted competency-based approach to medical and dental training in our continent. Your Excellency, ladies and gentlemen, finally, my last finally, let me end where I began. The environment is changing. The public is changing. Healthcare is changing. And the ambitions represented by universal health coverage require us to think differently about how our health systems are organized and governed. Regulation cannot remain unchanged in a changing world. But responsive regulation does not mean abandoning standards. It means applying standards intelligently to contemporary realities. It means listening to the public. It means being fair and inclusive. It means learning from failure rather than merely allocating blame. It means enabling the responsible expansion of our health workforce. It means helping to shape the kind of health professionals Africa needs tomorrow. Medical councils can only fulfill these expectations if they are better understood, appropriately recognized, adequately resourced, and institutionally supported. But with that recognition and support comes responsibility. Must always remain at the center of what you do. The legitimacy of regulation does not come simply from the law that established the regulator. It comes from the trust of the people the regulator exists
Our keynote speaker was our next week. Distinguished guests, ladies and gentlemen, kindly rise as we welcome our guest of honor, His Excellency, the President of Ghana, President John Dramani Mahama. Thank you. Kindly continue to us. Thank you. That reminds me of a joke I shared with our late President Jerry John Rawlings. We were together at an event in the Volta region. Of course, he comes from the Volta region. And for those of you who are Ghanaian, you know the Agbaja dance. Agbaja involves a lot of work with your back and your spine. And so I was sitting next to him and I joked and I said, I see the reason why Voltarians don't have back pain, because they are always exercising their spine. And then on another occasion, we were together at the UDS. He was being conferred an honorary doctorate. And I come from the north. And so they came in with this dance. And he whispered to me, he remembered. He said, you see the reason Northerners don't have waist pain? He says it's because of this dance. But let me proceed on the very comprehensive introduction that was made by the captain and crew of the flight that brought us here. And to say that there's this protocol that does this morning. And I hope that during your stay you'll experience not only our proverbial Ghanaian hospitality, but also our enduring commitment to Pan-African cooperation, public service, and the health and dignity of all our people. The theme of this conference, responsive regulation for safer communities towards universal health coverage, is often discussed in terms of hospitals, health, insurance, medicines, and the number of professionals that we train. These are important, they are essential, but coverage without safety is incomplete. Access without quality can cause harm, and health systems without public trust cannot endure. Every professional license issued by a regulator is in effect a promise to the public that the person entrusted with a patient's life has been properly trained, has been fairly assessed, duly registered, and will be held to clear professional and ethical standards. Regulation, therefore, is not a bureaucratic obstacle. It is public protection. It is patient safety. It is the foundation of confidence in the healthcare. Public trust is the currency of every good health system, and regulators are among its principal custodians. Africa's health landscape is changing rapidly, as our keynote speaker noted. Our populations are growing, and our disease burdens are shifting. We continue to confront infectious disease, as we've always done, while non-communicable diseases are increasing. Our health workforce is more mobile today than it was in the past. Our citizens are better informed and more knowledgeable. And digital health, telemedicine, and artificial intelligence are transforming how care is delivered. These developments create enormous opportunities, but they also create new risks for healthcare delivery. Technologies are emerging faster than many regulatory systems can respond to. Misinformation travels at the speed of light. Unqualified practitioners exploit gaps in enforcement. In emergencies and fragile settings, established systems of supervision and accountability may be disrupted. In such environments, regulation cannot remain static. It must be responsive. It must be firm. It must be fair. It must be protective and enabling. And it must be grounded in our African reality. But it must be informed by global knowledge. Responsive regulation is not simply about regulating more, it is about regulating better. It is about knowing when to guide, when to support, when to correct, and when to sanction. For Africa, the stakes are high. We cannot realize the aspirations of Agenda 2063 if our people lack access to safe, ethical, and quality health care. We cannot build productive economies if preventable illnesses continue to diminish the lives and livelihoods of our people. And we cannot retain confidence in our institutions if standards are weak or enforcement appears selective. Health is both a social good and a development imperative. The health of our people is the wealth of our continent. Let me therefore commend AMCOA for providing this platform for peer learning, regulatory cooperation, and continental dialogue. I also commend the Ghana Medical and Dental Council and the Ministry of Health for hosting this conference and for their continuing contribution to professional regulation, ethical practice, medical education, and patient safety. And now the 5 points on the theme. The first major challenge before us is how to protect patients during conflict, during displacement, disasters, and other humanitarian crises. In such settings, health workers may face danger themselves. Medical records may be lost, medicines may be scarce and unavailable, and vulnerable populations may depend on temporary facilities, field hospitals, and on foreign volunteers and mobile clinics. Regulators must therefore be able to verify qualifications, authorize emergency personnel swiftly, oversee humanitarian missions while maintaining accountability, without allowing urgency to become an excuse for abandoning standards. Indeed, when communities are most vulnerable, they deserve the highest level of a regulator's protection. The second challenge is the mobility and migration of Africa's health workforce. Doctors, dentists, and other professionals increasingly cross borders in search of training, employment, safety, and opportunity. This can spread knowledge and strengthen services, but its scale now demands much closer cooperation among regulators in different jurisdictions. Africa must not compete against itself for a limited pool of health professionals. We must cooperate to train more people, to retain more critical skills, verify credentials, recognize qualifications where appropriate, promote ethical recruitment, and distribute our workforce more fairly across the continent. A border may separate two nations, but it should never separate Africans from safe health care. Professionals who serve outside their countries of birth must also be treated with dignity and fairness, never with discrimination or hostility. Our health future depends on solidarity, shared standards, and mutual respect. The third point, we must govern the digital transformation of healthcare wisely. Telemedicine, electronic records, digital prescriptions, remote monitoring, and mobile applications can expand access, lower costs, and connect underserved communities to specialists. And Ghana has faced an example of this. We had invested in a digitalized medical record system, and the provider kept asking for more and more and more money. Of course, because he had the servers and he hosted the software. And it virtually became an issue of blackmail. And one day we woke up and the system was switched off. We had discarded all the old paper medical records. And so we had to go into the archives to pull out some of the existing records and also begin a quick fast-track, substitute for the system that has been switched off. So these are some of the occupational hazards and dangers of digitalization of our systems. Yes, difficult questions arise. Which jurisdiction applies when a practitioner in one country advises a patient in another? And it happens. You call your doctor in a different country, in a different regulatory environment, and he gives you the service. I mean, so which jurisdictions regulation apply? These are all questions that we must ask. What standards govern an online consultation? Who is accountable when an algorithm contributes to a harmful decision? Now we have AI taking some decisions on behalf of human beings. And so if the AI makes the mistake, who will the Medical and Dental Council summon to sanction? How do we protect our health data from misuse? And how do we prevent digital platforms from becoming channels for unlawful advertising, fraud, or unsafe practices? The answer is not to resist technology. The answer is to shape it in the public interest. Artificial intelligence must support, not displace, professional judgment and human responsibility. Africa must participate in setting standards, generating evidence, and designing technologies that reflect our populations and realities. Responsive regulation must bridge innovation and public confidence. And there's another example I found interesting. An AI had been developed to better diagnose breast cancer and lumps in women's breasts. Now, those who fed the algorithm fed it from several cases of identifying breast cancer in Caucasian breasts. They didn't realize that African breasts are a bit denser than Caucasian breasts. And so, oh, I'm sorry. If I've addressed a very sensitive issue. Yes, but women's breasts are said to have more tissue, but they have a lot more mass than Caucasian breasts. And so just going and taking AI and the software and coming and saying, we have a new AI for identifying breast cancers, you probably will be misdiagnosing. So these are all the safety issues that come up. Now my fourth point, and still bear patience with me. We must confront forged qualifications, fake licenses, professional impersonation, fraudulence, continuing development certificates, unlawful practices, and misleading health claims. When a fraudulent practitioner enters a consulting room, every patient who enters that room becomes vulnerable because fraud recognizes no borders. And so our response to fraud must be continental. No country should become a refuge for a practitioner who has been sanctioned elsewhere. And no community should be exposed to danger because regulators could not share verified information with each other on time. Secure, lawful, and timely data exchange among African regulatory authorities is therefore no longer optional. It is an essential instrument of patient protection. And the fifth one, our regulatory systems must become integral to Africa's health security architecture. COVID-19 reminded us that the next emergency is not a question of if, but when. Emerging infections, antimicrobial resistance, and climate-related health threats all require systems that can act quickly without sacrificing quality. Climate change is already affecting our health through floods, droughts, fires, and insecurity, displacement, and changing disease patterns. Antimicrobial resistance threatens to reverse decades of medical progress. Many future threats will arise at the intersection of human, animal, and environmental health. And so for that reason, regulators must embrace the One Health approach and work with public health authorities, veterinary regulators, environmental agencies, laboratories, and research institutions, because preparedness cannot begin only after a crisis has arrived. Now I'll tell you a little about Ghana. Ghana's health agenda is anchored on equity, equality, and sustainability. We're strengthening the National Health Insurance Scheme, and we currently have a national coverage of 76%. We're hoping to push up to 90. But that, as Dr. Anefi tells us, even 90 is an ordinary pass. We wouldn't have failed, but it would just be a pass, because it means that 10% will still be uncovered. And that is why we have introduced two new schemes to go alongside the National Health Insurance. And the one of which I'm most proud is the Free Primary Health Care Program. And I want to thank the World Health Organization and all our partners, the government of Kenya, whom we copied copiously from. You can claim copyright, Captain, after this, after this function. And so we are modeled a bit on the Kenyan free primary health care coverage. And we've started with about 160 districts. Ghana has 260. So we still have 100 districts to onboard. But that is where the preventive side of our healthcare is being implemented. And this covers mostly people in the rural areas who have no access to the facilities, have not been covered by the National Health Insurance. They can go to any of the CHIPS compounds, the mobile health kiosk, and receive treatment free of charge without showing any identification. And so we believe that that will help us one more step towards universal health coverage. We're pursuing free primary health care so that cost does not prevent people from receiving essential care at the point of need. Through the Ghana Medical Trust Fund too, we are seeking to protect persons living with chronic and high-cost conditions from financial hardship. We're also advancing the conversation on African health sovereignty. Health sovereignty does not mean isolation. It is the capacity to meet our people's needs confidently, competently, and through mutually respectful partnerships. Africa must invest in its workforce. We must mobilize sustainable financing. We must expand local production of medicines, vaccines, and health technologies, and build reliable data systems. In Ghana, 70% of the medicines that we consume in our health system are imported. We've come up with a 5-year plan to make sure that we reverse that, and that at least 70% of the medicines we consume must be produced locally in Ghana. We must also invest in governance standards, ethics, and trust. This is where strong, independent, and adequately resourced regulators become indispensable. And so now let me inflict on you the 7 points of reflection for this conference. And I assure you they will be briefer than Professor Anefi's finally, last finally, first finally. I have no hidden finals here. And so first, over the next few days of your meeting, I urge you to focus on 7 priorities. The first is to strengthen regulatory harmonization through deeper cooperation, reliable verification, and appropriate recognition of qualifications without lowering standards. The second must be to invest in regulatory science so that decisions are informed by evidence and regulators have the skill to respond to new technologies, changing workforce patterns, and emerging risks. The third is to build secure data exchange systems that support timely information sharing while respecting privacy and proper data governance. The fourth is to protect the integrity of health professional education. The quality of tomorrow's healthcare depends on the quality of the training that we give today. Accreditation, assessments, internship, continuing professional development, and ethical formation must remain central to this objective. The fifth is to develop practical frameworks for humanitarian and fragile settings, enabling rapid emergency response while preserving standards and accountability in times of crisis. The sixth is to regulate digital health and artificial intelligence with urgency, wisdom, and a clear commitment to equity. And the final and the seventh is to place the patient and the public at the center of every regulatory decision we take. The true measure of a regulator is not how many licenses it issues, but how effectively it protects the people and the patients. Universal health coverage cannot exist without universal health confidence. Citizens must know that whether they enter a clinic, a hospital, theater, or even on a digital platform, the professional attending to them is competent, ethical, and accountable. So this conference must move beyond discussion. It should produce practical outcomes, stronger collaborations, implementable policy recommendations, capacity building plans, improved information sharing, and a renewed continental commitment to high standards. And so let this Accra conference mark a new phase in African health professional regulation. Let it be remembered as the gathering at which regulators embrace not only national mandates, but also a shared continental responsibility and affirm that patient safety has no borders. To you regulators, I say, your work may not always be visible, even though Professor Nefi says you should make sure you make yourselves more visible and let the public know what you're doing. But still, your work may not always be visible, but it is vital and critical. When regulation works, harm is prevented, confidence is preserved, and lives are protected. And so you are guardians of the public interest. And to us policymakers, the minister and myself, I say let us provide regulators with the legal authority, institutional independence, the resources and technological capacity required to perform their duties effectively. That is the duty of us policymakers. And we have to work with our international partners. And so to our international partners, I say support Africa not only to deliver health services, but also to govern those services well and strengthen the institutions that sustain them. Ghana believes deeply in African cooperation. Our common challenges require common solutions, whether in health security, workforce development, digital transformation, professional mobility, emergency response, or regulatory reform. No African country can succeed in this alone. We must learn from one another, we must support one another, and build systems that are African in ownership, global in quality, and uncompromising in their protection of the public. As you deliberate in Accra, I encourage you to be bold, practical, and forward-looking. Let your discussions be honest, let your recommendations be implementable, and your partnerships enduring. And so, on behalf of the government and people of Ghana, I once again welcome you warmly. May your deliberations be fruitful, your contributions to Africa's health future be significant. And with these remarks, and I'm done, I assure you, it is my honor and privilege to declare the 28th Annual International Conference of the Association of Medical Councils of Africa officially open. I thank you. Thank you. God bless you. I'd like to invite the Honorable Minister of Health, members of the AMCOA Management Committee to join His Excellency the President for the first official photograph. 3 photos. Thank you, Mr. President. Take our photos, 3 photos. The Honorable Minister for Health, Honorable Akando MP, and members of the AMCOA Management Committee, you join Mr. President for the first 3 photos. You are the standards, and then we'll have others join you. So, thank you so much. While they are taking the first photo, I'd like to invite the heads of delegation of the AMCOA member councils to be getting ready. So heads of delegation, please stand by. You'll be in our second photo. Can we have the heads of delegations, please? Heads of delegation, please join them. Yes, we have stairs here. Heads of delegations only to join this photograph. Is our stage big enough? Okay, all right. Then move forward. Yes, yes. Get closer, yeah. Thank you. So these are, Mr. President, the Minister for Health, AMCOA member councils, and heads of delegations of the AMCOA member councils here joining us for this photo. And the third and last photo will also invite the council and management of the Medical and Dental Council of Ghana to add to this rapidly expanding family. Okay, so now we have the council and management of MEC Ghana to join for the third photo. Thank you very much, Head of Delegation. This space upstairs. This space upstairs. Lots of room at the top. There you go. Distinguished ladies and gentlemen, please consider that they are all smiling. Yes. Are we done? One more. Good. Thank you so much, Mr. President. Thank you. And I invite Dr. Divine Ndombi Banyubala, Registrar and Chief Executive Officer of the Medical and Dental Council of Ghana, to deliver the vote of thanks as we bring this official opening ceremony to a close. Dr. Banyubala, for the vote of thanks. Oh, I think he deserves a nice round of applause.
Thank you very much, Kafi. Your Excellency, may I seek your kind permission to stand on the well-established law. On behalf of our Honorable Minister and the board, the 11th board of the Medical and Dental Council of Ghana, and the President and Management Committee of the Association of Medical Councils of Africa, I have the pleasant duty of expressing our sincere appreciation to to all who have made this opening ceremony of the 28th Annual International Conference on AMCOA a great success. Your Excellency, we are especially grateful to you for honoring our invitation and joining us today. I remember I was at the function with my big brother Victor, and we were listening to His Excellency espouse obstetric knowledge, talking about abnormal lie, transverse lie, and delivery. And I said, Victor, let us find out from our minister. Has he been given His Excellency some crash course medical education? And today, there's a professorial award in public health. And just to assure Senior Nefi that here GTEC's mandate is limited. Therefore, with the leave of my board chair and the board and then the president of AMCOA, I can now declare that you are Professor of Public Health with cross-border approval verified and confirmed as you march towards your leadership of the continent as the next chair of AD. So your presence at this morning's gathering of health professional regulations from across Africa is in itself a very, very powerful affirmation of the importance of professional regulation to patient safety, public confidence, and the development of our healthcare systems. We are grateful for your message to us this morning, particularly for the encouragement you have given to us as regulators to remain responsive to the changing needs of our societies, whilst continuing to uphold the standards upon which the public trust depends. We are equally grateful to you, Honorable Minister and my own brother, for the leadership, the vision, and the long-standing interest in the work of the Medical and Dental Council and AMCOA. And in fact, when you were ranking member, you went everywhere with us. And I have no doubt that that is why sometimes when you are, at the heads of agency meeting, and I see you and you isolate the issues, you say, should we also confer another medical qualification? To the other ministers of state, if you are here present, members of parliament who are here, and I understand Honorable Charles Abebe, you are here representing the Parliamentary Select Committee on Health, and all other heads of agencies who are here, who have joined us. We thank you for taking time from your demanded schedules to be part of this occasion. So your presence reminds us that the work of professional regulation intersects with many areas of national development and requires collaboration beyond the health sector. We are especially privileged to have benefited from the wisdom, the wit, the experience of our keynote speaker, Dr. Anefi Asamoah, who has inspired and mentored many of us. Shall we once again just give it? Sir, thank you so much for sharing your insights with us and for challenging us to think deeply about the future of healthcare and regulation on our continent. Your contribution has provided an important foundation for the discussions that will continue throughout this conference. To the President and Management Committee of AMCOA, thank you for your leadership and for the confidence placed in Ghana to host this 28th Annual International Conference. AMCOA continues to provide a unique platform through which African regulators can learn from one another, confront common challenges, and build relationships that make our individual regulatory systems stronger and better. We acknowledge with gratitude our colleagues, registrars, CEOs, council, board chair members, and representatives of regulatory authorities who have traveled from across Africa and beyond to be with us this morning. Some of you have traveled considerable distances to participate in this conference. So your presence, your experience, and your willingness to share knowledge. We are also grateful to our international and regional partners, development partners, professional associations, the various colleges, universities, training institutions for your continued engagement with the regulatory community. In particular, we recognize AMCOA, represented by the chair and 3 of us who are the board directors, and the WHO, represented here by the country representative and then the Afro region. To our speakers, moderators, panelists, facilitators who will lead us through the various sessions over the coming days, thank you in advance for the expertise and the perspectives that you will help to bring to our deliberations. I must also acknowledge our sponsors, partners, whose financial, logistical, and material support has contributed significantly to making this conference possible. We sincerely appreciate your confidence in the work of AMCOA and the Medical and Dental Council of Ghana. And to the chairman and members of the Medical and Dental Council, thank you for the leadership, for the confidence, for the guidance, and for the support you have provided throughout the planning process. And to the conference planning committee, my management team and staff of the Medical and Dental Council and AMCOA Secretariat, headed by Sadiqa, our service providers who have worked throughout Your Excellency 24-hour economy. That is what we did. The volunteers and everyone working behind the scenes, I wish to place on record our profound appreciation. A conference of this magnitude does not come together by accident. It is the result of many months of planning, numerous meetings, long working hours, and now you know we did 24 hours, and considerable personal sacrifice. Thank you for your dedication. And distinguished delegates, we have had an inspiring beginning, but the opening ceremony is just a starting point. The real value of this conference will come from the conversations that will follow, the experiences we share, the assumptions we challenge, the lessons we take from one another, and most importantly, the practical actions that emerge when we return to our respective jurisdictions. So the team before us calls for responsive regulation. So over the coming days, we have the opportunity to give practical meaning to that idea and to explore how regulation can continue to protect the public while responding intelligently to the realities of changing healthcare systems, changing technologies, changing workforces, and changing communities. I therefore encourage all delegates to participate fully, speak tangibly, and take advantage of the extraordinary breadth of regulatory experience assembled here in Accra. And to our international guests, once again, Akwa, Obake, welcome. We hope that beyond the formal program, you will enjoy Ghanaian hospitality, renew old friendships, establish new ones, and leave Ghana with pleasant memories of your time with us. Your Excellency, my Honorable Minister, members of Parliament here present, distinguished guests, ladies and gentlemen, our friends and partners from the media, on behalf of the 11th Board of the Medical and Dental Council and the Management Committee of AMCOA, I once again thank you all for honoring us with your presence and for contributing to the success of this opening ceremony. In fact, it is historic because this is the first time that at an annual conference of AMCOA, a sitting president has dedicated nearly 4 hours of his time. May the discussions that begin here today strengthen our institutions, deepen cooperation among our African regulators, and contribute ultimately to safer healthcare for the people we are privileged to serve. Midasiki, Tipabia, Tudomanani, Akbar, Obata. Thank you for coming, and I wish all of us a very productive and successful conference.
Thank you very much. This brings us to the formal close of the official opening ceremony, 8th Annual Scientific Conference of the Association of Medical Consultants AMCOA 2026. Before we proceed, a brief program note for our delegates. Following the departure of His Excellency the President and the official party, we will have a brief security briefing from Mr. AMCOA, who is Assistant Security Manager of the Level Ambassador Hotel. May I therefore kindly ask you, the delegates, to remain in the hall following the presidential departure. Thank you so much for your attention. Distinguished ladies and gentlemen, may I respectfully request that we all rise for the departure of Another one.